Really want to welcome you all. This is such a great event. We had it last year, and so much full of excitement. And the first day doesn't look like it because you haven't formed the full teams and the topics are not there. But once you start saying, oh my God, you have to deliver on Sunday, and how fast the other teams are working, you will really start kicking very fast. And that's the moment we call Kodak moments. We start taking pictures very fast, and it's amazing, just with high energy and competition, what can come within 48 hours. So my goal is just to kind of expose you to all the resources you have today available to get you the best from your creativity, from what you really want to do. So just very brief about Mount Sinai Health System and how we see it. We are now a 7-hospital health system across all the boroughs. But really what is the center point of that is 2,000 trainees, residents. I think that creates all the creativity, energy, and interdisciplinary kind of stuff that we need here. But what I really want to articulate today is this all is learning lab, right? So we see what are the unmet needs of the patients and the caregivers, like what Janice mentioned. But when you build something, also don't just build it and stop at today at Sinai Hackathon. My plea to you is you take it all the way and use our learning lab or other health systems learning lab to really see whether you can touch the patient's lives in some degree and make transformation happen. So that's why the title today is from innovation, which is happening today, to actually continuing your journey to transformation, which really want to get to you at that point. And just very briefly about the resources that are there. We have a lot of AppLab people, if you want to raise your hands. Right, so we started 5 years ago at Sinai, and people were saying, you are crazy. You just want to build apps? Aren't you a doctor? You should do something else better. I said, no, what the app does is really makes us virtually available everywhere. If I want to do something good, maybe I can just a video record of myself and I can make ourselves to patients all over the world. So it can scale exponentially what you really want to do. And with that, we started this vision. We got a user interface patient journey designer, and that's exactly you will need in your team. We have a front-end developer. We have a web services person who will do API. And you may not have that person in your team, but we have Sarthak there, and Sumit, and Milan, who's gonna actually help integrate your tools with each other. Then we have a data science person, which many of you already have. And then you'll need a clinician in your team. And after today, after this weekend, you'll also need someone who's gonna help evaluate your thing over a clinical trial or something. So we have all of that expertise in-house under one roof, just so that we can build, deploy, and test solutions which are working and not working. So talking about testing, we call ourselves as an academic research organization. So we do clinical trials, but we do clinical trials not on devices or drugs. We only do clinical trials on apps. And comparing one app with the other, or what has been the usual care with others. And we love to test your technology, bring it to the patients, and see how we can not only take your technology, but actually meld it with other different streams of digital medicine, like telemedicine or AI or something, because sometimes really the magic happens when the technologies come together and not just one piece of technology. And I'm giving you kind of a cheat sheet for your slide, which you're gonna have. So if you don't know how you can articulate a business case for whatever you are building, just look up value-based healthcare, and I bet you whatever you make will have alignment with value-based healthcare. What does that mean? There was a very big announcement 2 years ago which said 50% of the payment that's gonna be made by CMS will be not fee for service when a doctor sees the patient in office, but really actually if a doctor really does take care of the population or the patient outcomes, right? What that means is when we typically see our patients, so far most of the healthcare has been delivered in a space and time that's limited. The patient has to come to see a physician in an office-based setting or a hospital-based setting, and that's where the medical care is delivered. With the technologies now, more and more, we need to deliver the care outside this hospital and the clinic, because 99.9% of the time, patients spend time outside the hospital setting. And we never had tools like we have before, where we can allow this remote monitoring care to be enabled, right? And that's what we are now being incentivized, right? So in a value-based healthcare, it's not about the patients I see every 3 months in my clinic, and I pat myself on the back and say, Ashish, job well done, go. But actually, I'll be really penalized or rewarded by patients who are at home and who are having missed days in school or college, who are really having fatigue and having poor quality of life or depression. I'll be also really penalized on patients who have seen me once, maybe got a bad dysplasia or adenoma, and they never got a chance to see me back, and I have no way of recalling those patients back. And they suddenly turn into cancer, and then our health system has to pay for it. So Mount Sinai already has 350,000 lives, which we are fully at risk, like a pair. So earlier, if a patient used to come to our hospital, we used to make money out of our hospital. Now, if the same patient comes into our hospital, we lose money because our job is to keep the patient outside the hospital because we are fully at risk for those patients. And also, patients who are waiting to be correctly diagnosed, they will also become part of our at-risk population. And what are the toolkits you have? And I can urge you, you don't need to look anywhere outside. The smartphone you have in your pocket is the biggest toolkit you can have. And I'm really looking forward to having a very interesting kind of a way you're going to utilize this power. Do you know this smartphone alone is more powerful than all the supercomputers NASA had in 1969? Look at all the big mainframe computers you see where the Apollo mission happened and the man landed to the moon. All those supercomputers combined, you have more power now in your one device, right? And not only you have more power, you have more streams of way you can interact with things that was never possible before, right? So for example, microphone. The microphone has ushered in people can now diagnose depression because in the beginning when I can speak very enthusiastically like I am now, maybe in 2 hours I'll be speaking like this. And using AI and microphone, you can actually detect person who is depressed or anxious, right? So the field of camera, simple camera which is here, has revolutionized the field of telemedicine. I was doing telemedicine in 2002 when we had $75,000 Cisco devices, but you have to be within one's room, and the patients has to be coming into a different room, and we can then do telemedicine. Now, anywhere I can turn on, and I can have a telemedicine conversation with my patient, right? So think of how you can harness this Bluetooth connected, which can totally connect with Internet of Things, right? So we have Peter here, who's going to enable the power of all these sensors you can use, pressure sensors to temperature sensors, connect with Bluetooth, and the data can come back into an app. And within 48 hours, you can actually have a data coming back and show that and impress the judges, and maybe go to the Shark Tank as well. So talking about technologies, and I'm deliberately giving non-cancer examples not to get you into one direction, but the technologies have become so mainstream that WellDoc was the first app to get FDA approval, right? And when they went for FDA did not know how to approve a software. They never had people outside who could approve a drug or a device. So they had to convene a special group of software consultants. And the number one thing which convinced, which I think can be in your slide deck as well, and I'm giving another hint, is outcome improvement, right? So they showed 1.2% improvement in HbA1c, which is average of sugar over 3 months, which was the same improvement in a clinical trial they showed, which was shown by a drug which took $1 billion to come to the market, right? So FDA suddenly said, oh my God, traditionally they were only drugs and devices, but now you can have an app which is not delivering new medicine, but just optimizing care by remote monitoring. By someone connecting the glucose monitor, they value directly going to a computer with AI and saying how they should change the dose with backup of health coaches, right? So sometimes technology doesn't have to be very sexy, but it can deliver outcomes. And sometimes things can be so simple as text messages, right? So this study was published in JAMA. Just 4 text messages a week, right, can actually reduce smoking cessation by 49%. Can you believe it? 49% is more percentage smoking cessation than all the 3 medicines which are here today FDA approved for smoking cessation. Just 4 text messages. So we have to learn to do it in the right manner. And there are also technologies like, one thing which I'm just thinking, we probably don't have a augmented reality or virtual reality set, but nothing is stopping you. Oculus just came with $199 device. You can buy it today, get it shipped tomorrow, and you can actually show it and impress and win the award. Virtual reality is becoming so much mainstream, and I'm really out there when I talk about technology. And I used to think virtual reality is out there till this study got published, which showed that you can have a virtual immersion. We call it distraction analgesia, right? When burn patients are actually changing their dressings, you can reduce by up to 50% their opioid usage by having them watch a virtual reality game called Snow World, where they're dodging the snow, right? Just by dodging the snow, they are so much focused in dodging the snow that they don't feel the pain that's going. And if you see the MRI records, These are all the pain signals which are lighting up in the brain. And look at when you do the virtual reality, they've really decreased a lot, right? So there's a lot of apps, there's a lot of technologies, but you can see convergence between the apps, telemedicine, and also Internet of Things and devices. So we started off with wearables, but now we have indigestibles where you can measure if a patient is taking a medicine the right way or not. Not only you can know the exact time when a patient has taken in the medicine, but you can know the exact time when a patient has pooped out the medicine as well, right? So we'll have a lot of these devices for you, and just kind of how people have started using these devices. Some of the ways really the magic can happen is not traditionally the way the devices have been used, but in very novel ways the devices can be used. For example, I'm aware of a smoking cessation company which used the wearable device, but how using AI, the geolocation or accelerator, how the movement happens, to predict if a person is smoking versus a person is combing the hair or actually eating food, right? So then they can create an endpoint. They can not only offer a smoking cessation toolkit, but they can see if a person is really continuing to smoke or not based on just AI and the wearable devices. And then using geolocation, GPS, they can say, is this happening at work or at home? Is the wife the cause of it or the boss the cause of it? Right? So if you really look at envisioning digital care for 2020 for cancer, I think these things are gonna become mainstream. But the question is it one of you who are gonna help make these things mainstream, right? So messaging bots, AI, I think IBM Bluemix is also here, and Persistent probably can help with those, creating some bots for you. Remote monitoring we talked about, Internet of Things, smart devices. I don't know how you're gonna do proteomes and metabolomic work here, but maybe if you have some open data sets, which are already out there on the internet, you can probably leverage them to do some decision aid and those kind of things. And Janice mentioned briefly about it, social determinants of health, right? So there's a big disparity gap. One of the key focus areas AppLab is now doing, especially looking at East Harlem population versus Upper East, such a big different population. We want to see how we can, from digital divide, we can create a digital bridge using technology. So if you come with some fancy solutions in that regard, that will be very welcomed. And really, the things you're gonna make, we're gonna do very interesting thing this hackathon. We're gonna enable, for the first time, this has not happened in any other hackathon before, we're gonna help prescribe your solutions within 48 hours. So you will be able to build a solution, especially it's an online solution. You'll be able to prescribe to the judges, you'll be able to prescribe to your friends, and once validated, you'll be able to prescribe to patients. So we're gonna turn on a platform called Prescription Universe. We'll be able to embed, and our team will be here with API to embed your toolkit. So by the end of hackathon, we've already created a hackathon profile, and all of the tools will actually come into one single hackathon profile, and we can prescribe to different people and get their input, how good they think about it, right? But talking about your journey, if you are thinking of making a mobile app or some similar solution, my urge to you is not only just go tomorrow and just start creating the app, but actually take a step back, really start with a process of understanding the bigger your need is and the better your solution is gonna be, right? You can make a very fancy solution, but if no one is gonna use it, it's not of any use. So really take time today. I think Janice's slides, I don't know if that will be available to the hackathon people, so you can see major themes that are coming, and look at what the understanding is. Then do user research. We talk about looking at persona. Who is gonna use it? Is it patient or physician or both? How are they gonna use it? When are they gonna use it? And what are they gonna do when they use it? So look about, these are mostly sketch. You do the persona, you talk to the people. Hopefully there are enough clinicians around, you can get those insight as well. Then do discovery. What I mean by discovery is make sure that has not been done before, right? If that has been done before, either do it in a slightly different way or a majorly different way, or think of some other idea. There's no point recreating what someone else has done. Then if you're ready with that, then create wireframes. Just use this plain paper and say when a patient sees, this is what it looks like. Once you've done the wireframes, we'll lay open some tools to you, which are free on the web, where you can do mockups and kind of give an appearance. Even if you don't have a programmer in your team to design an app, you can actually mimic an app very closely using those free tools. And so when you can impress the judges with that. And if you're ready and you have a programmer, we'll help you to finalize the code. We also can host the code. So you will have actually an app up and running by the end of 48 hours. We'll be able to prescribe your apps if that's an app. But one of the things which I'll request to you is don't stop your journey by creating thing here. Really, evidence is the key. So this is a very fancy study done by UPenn. All these wearable devices, measuring when the person takes the medicine, giving coupons to the patients who do it, no result at all, right? Because these were done not by clinicians, but by health insurers. So patients had no trust into it. So try to find the things, not digital health, but actually digital medicine, which is not just innovation, but actually going into transformation. And I'll be the first one to offer you to publish your stuff in the journal we have launched, the Journal of Digital Biomarkers. So we don't want just well-published randomized controlled trial. We want to publish pilots and make them mainstream for free in the community. And I also like to welcome you to submit the things you built today to publish it as an abstract in the conference we are doing. This is the first scientific conference in digital medicine happening here in New York City. And we love to have participation, see these hackathon group actually going there. So I truly believe digital medicine is medicine. Just to give you an example, there'll be a prescription of a survey coming to you right into your smartphone. And what I would not tell you, maybe I should tell you, we'll be tracking who is clicking on that survey or not. So we can do that real time. So think of it as a way we can deliver technology to the patients as well. I really am interested to know what will your be success story and how we can support to get you there where you want to be. Thank you very much.